Hi everyone, welcome back to my channel. It has been maybe a week since I last updated. For those of you that are new, welcome. My name is Emily. My life is generally a dumpster fire. Which, I mean, that's not entirely true, but it feels like that most of the time. Anyway, welcome. Just want you to know what you're signing up for when you watch this video. So, it's been a rough week, I'm not gonna lie. So a week ago we found out that this third pregnancy that we had conceived was going to be yet another non-viable chemical pregnancy. This exact same situation happened again 2 months ago. So I think coming off of that one and then, the next cycle that we tried, the exact same thing happened, has been difficult for me. With the second chemical pregnancy that I had in July, honestly, I was obviously sad and upset about it, but I really feel like I just kind of moved on. I was like, okay, well, that's the first pregnancy I've had in years, so maybe, my body's just figuring things out and I'm just going to move on. And that was kind of it, to be perfectly honest. Like, I don't really feel like I grieved a whole lot. So, this third one now I feel like it's really kind of taken the wind out of my sails quite a bit. I just, obviously, like, I'm sad and I'm mad and I want to know what's going on. I think that's the biggest thing. When I had my second chemical pregnancy in July, I asked for testing for recurrent pregnancy loss. And I was told by my reproductive endocrinologist that that was something that we could discuss if I had a third miscarriage. So here I am. I've officially met my, miscarriage quota, I guess. So now we can talk about it. So I have an appointment today in a couple of hours. I requested this appointment with my physician. And in the message that I sent requesting it, I said, I have several concerns regarding my plan of care. So I am planning for this to be my airing of grievances because I have got many. And I'm nervous. I'm nervous that I'm going to end up chickening out because, being in the healthcare field, there is a certain stigma about the kind of patient that you are, as evidenced by the lovely psychologist that we had to see a couple of weeks ago for IVF. The end of the appointment, she says to me, "And healthcare workers make the worst patients." And I was like, yep, I do know that. You're not telling me anything I don't know. And first of all, it pissed me off. But in my attempt to work very, very, very hard not to be that patient, I've not been my best own advocate. So that's kind of what today is. I have a lot of questions. I have them written down. I think that I want to get my points across, that I'm really not happy. But I also don't want to be unprofessional and rude. And to be perfectly honest, depending on her reaction, I'm perfectly ready to walk away from this clinic, which sucks. It sucks because, it is the middle of September now and we've met our deductible and we would have no out-of-pocket expense for IVF. And if we end up switching clinics, we're going to have to completely start over. And the odds that we would actually get an IVF cycle in before the end of the year, it's pretty much non-existent. But I mean, if that's how it has to be, then that's how it has to be. But even to that end, you know, I'm over here questioning a lot, like, do we need IVF? You know, my body is obviously trying to get pregnant. I've gotten pregnant the last 2 cycles that we tried. Apparently my issue at this point is that I can't stay pregnant. So, like, is anyone concerned about why that might be or want to look into that? I'm very, very frustrated. And it's entirely possible that I'm projecting a bit of my, you know, frustration over the situation onto my physician. I do, though, think that I have very legitimate concerns and grievances about the way that things have gone so far. So I need to find like a happy balance between being like riled up but also calm, because I don't want to come across as just like some crazy like mad lady who's taking out all of my frustration on my physician, because that's not the case. I'm just frustrated. So that's kind of where we're at right now. You know, as of right now, as of right this second, our plans have not changed. But it's entirely possible that by the time I update this video this afternoon, things could have changed pretty drastically. So stay tuned. I will update you guys as soon as I get home. Bye. Good afternoon, ladies. So I am here to update my video. It is the next day. I definitely did not get back in a reasonable amount of time yesterday afternoon after my appointment to get this filmed, so that is what I'm doing today. Overall, my appointment, I feel like it went very well. I did chicken out a little bit and I did not bring up the whole like fat shaming element and how she had been making me feel. I was prepared to, I think, kind of depending on how receptive she was to me. I was kind of like prepared to do that, and maybe I should have just done it anyway for, I don't know, my own like peace of mind or whatever. So I got there. I ended up having to wait like 20 minutes, which is fine. I honestly, like, people get really bent out of shape about waiting. I'm not one of those people because I work in healthcare and I understand how things go. You get backed up and that's just kind of like how it is. And I have the luxury of literally having nothing else I need to do. So I can be very, very patient. It's fine. So she sent in the 4th year med student first, which, bless her little heart, you know, she comes in and I was anxious and, you know, the feelings of frustration, and I'm just like trying to keep myself, you know, bolstered and built up. And then walks this little like 4th year med student, it's all jolly. And she's like, "Do you remember me from last time?" And I was like, "Maybe." I don't know. "You're not the one I want to yell at. Get out of here." So she sits down and she was very, very sweet, and, you know, first and foremost acknowledged that she was so sorry about my loss and asked how I was doing. So I did appreciate that, even though it was a very like kind of curt answer. And I just said, "I'm frustrated." But she talked a little bit about the testing that they offer for recurrent pregnancy loss and asked about what I knew about the test so far, which, I mean, I don't really know a whole lot. So, and then maybe after 5 or 7 minutes or so, maybe not even that long, 5 minutes, the doctor came in and Again, she led with that she was very, very sorry for our loss and wanted to know how I was doing. That was very important to me, because especially coming off of the heels of the psychologist telling us that, a chemical pregnancy really isn't a miscarriage. Like, having her validate that for me was important, because I was fully expecting the opposite thing to happen. So I think the fact that she led with that kind of helped to like stifle my rage a little bit. So I told her everything that, I had been experiencing and feeling. So one of the things that I noticed with these last 2 pregnancies was probably starting 2 or 3 days, I would say, before I got the positive pregnancy test, I started having heart palpitations. And that's not something that I normally ever get. And it was to the point where it was very noticeable. I wasn't like dizzy or lightheaded. My blood pressure was always okay. But it definitely kind of like impacted my sleep. Like, I didn't feel like I could lay flat. I had to kind of sleep propped up on the couch. And of course, being a nurse, I was like, it's fine, it's nothing. I'm not going to the hospital for them to do an EKG and be like, looks okay, because that's exactly what would happen. But it very much felt tied somehow like to the pregnancy. And it did not go away until the first day of my heavy bleeding in both cases. It was very, very strange. Like, especially this last one, the heart palpitations were much worse, I would say, or much more noticeable. I kept finding myself having to kind of like take a deep breath to kind of like try to calm them down. And literally the first day that I started bleeding, they were gone. So I don't really know what that means. I told her about it. She found that to be kind of concerning and curious. She said it kind of sounds like an overactive thyroid, which I am taking thyroid medication. However, I don't officially have hypothyroidism. The reason that my OB prescribed me the thyroid medication was because she thought my T3 could be closer to the therapeutic range. Mine was on the low range of normal. So I've been taking this thyroid medication for, I don't know, at least 6 months, but it's never been rechecked. So she's definitely going to check my thyroid, kind of see what's going on there. And she says, if it happens again, she wants me to get a cardiology consult. But again, I appreciate her not just like blowing it off and being like, yeah, I don't know, that's weird. Maybe you were just anxious, because I feel like that's what everyone wants to say, is maybe it was just anxiety. And like, I mean, yes, I'm anxious, but no, I don't think that's what it was. But whatever. So while I was there, I basically had every single lab drawn for recurrent pregnancy loss that they offer. I think they did a lupus antibody test. They did 2 different antiphospholipid panels. They did a TSH checking my thyroid. They did a prolactin, which is a hormone that can cause recurrent pregnancy loss if you have a high level of prolactin. They checked my A1C. They did my genetic karyotyping, and Chris will go in on Monday and have his drawn as well. And that's basically looking at our genes, our genetics, to see if there's anything individually that could cause, a problem, or anything like a combination of our genetics that could cause recurrent pregnancy loss. At least that's how I understood it. So all things being said and done, it's going to take probably a few weeks up to a month for all of those results to get back. So needless to say, we cannot try to conceive this cycle, which I wasn't planning on it anyway, because if there is something going on, like, we'd probably just end up in the exact same situation. So we're just kind of on hold at this point. Something else that I did talk to her about was, I feel like my body is trying to get pregnant. Do we need to do IVF? And unfortunately, we're in one of those situations where there's no like clear answer. It'd be one thing if I had, blocked tubes and they were like, your only option is going to be IVF. But I'm not in that position. Like, my labs, on paper, I look great. My ovaries look great. My uterus looks great, aside from having a couple of small fibroids. Chris's semen analysis is great. And it's like, well, all of that is good news. It's really frustrating to know, like, moving forward, what the right thing is. Because, like, if we could avoid doing IVF, that would be great. If we didn't have to do that. So she talked about some of our options, pretty much being, we could try 2 cycles of IUI with, like, injectable medications if we wanted to do that. And I guess how I feel where I'm at is just like, I'm kind of like, I don't know. I mean, yes, I would like to try that, but if it didn't work, am I going to regret making that decision? So I kind of feel like we're just gonna keep moving forward with our plan for IVF, which means when I start my period in October, I will call them, they'll start birth control as part of their down regulation protocol and go from there. So as it stands, our plans have not changed. The time frame might change a little bit, just depending on when we get all of these labs back. But for right now, the plan is still to start IVF next month. So that's that. I feel much better about my physician. I think moving forward, if anything is said or if I'm made to feel any kind of way in that moment, I'm going to bring it up. Excuse me. And that's just, something that I need to do for myself in order to be my own advocate. So that is very hard for me, but that's just kind of how it's going to have to be. So this video is going to be like a million minutes long, so I'll wrap it up here. It is Wednesday, and my sister and brother-in-law are coming in town tomorrow, and I am so freaking excited about it. This is definitely the longest I've gone without seeing my sister. I haven't seen her since Easter, so super excited about that. I hope everyone has a great rest of their week, and I'll, be keeping you updated as I get these lab results back. But, videos might be a little bit sporadic for the next few weeks or so, just because I don't really know that I'll have a whole lot to say. So, hope you're all well. Thank you for watching. I appreciate everyone's kind words and support and messages. They have really meant a lot to me. So, I'll talk to y'all soon. Bye.